So I'm here with Mario Schlosser. For those of you who don't know, he's the CEO of Oscar Health, and I am Zach Tracer. I write about healthcare at Bloomberg News. And I'm excited because I think Oscar is one of the most sort of interesting companies in healthcare. Also excited because Oscar had some news today that I wanted to just start with and ask you about. Do you want to just tell us about the news, and then maybe we'll go from there?
Definitely, yeah. First of all, it's great to be here. Thanks for doing this with me, Zach, and thanks to CB Insights for the invitation. We announced this morning that we're expanding into a couple more states. If you look at our trajectory, we got founded in 2012. Josh and I, the co-founders, got together, realized we thought healthcare is way too cumbersome and complicated on the one hand, and probably partly as a result, way too costly on the other hand. And we thought that the insurance company sits at a very interesting nexus in the healthcare system where it can see lots of the data running through the system and has its hand on the financial incentives in the system as well. Kind of every incentive in healthcare in the end goes back to a configuration in one insurer's claim system, if you think about it that way. And so we thought that if we can start an insurance company where we build a very different member focus into the way the insurer even feels to you as a member, into everything we do, that could be very, very powerful, because we could become much more a navigator through this complex healthcare system for you as an end user than other insurers can. And so this morning we announced that we're going to expand into a couple more states. We last year were in 3 states. This year we're in 6 states. We're going to 3 more states for next year, and we're almost doubling our footprint, going from 8 cities to about 14 cities for 2019. That's exciting.
And now, how did you decide which cities? We don't know all of the cities. We know, I think, Orlando, El Paso, Memphis, sort of the Detroit area, a few more that are sort of secret still. But how did you pick those cities?
So one of the interesting things about being a insurance company, a technology-driven insurance company, and sort of like coming at this from the tech angle. I'm a computer scientist originally. I was going through pregnancy. My wife was going through pregnancy. We started Oscar, and that's how we kind of got into thinking healthcare is complicated and costly and so on, is that you can't really apply the usual recipes you have from the technology world. You can't just kind of go into a market, test things out, and if things don't work, you go elsewhere. We have to file rates for our 2019 plans right this moment. We had to start planning against our 2019 expansions, really going at least a year back, go around the country, talk to hospital CEOs, talk to physician leaders, piece together and start building the network, the plans, the benefit designs, and so on. And the way we do that is we have a list of about 100 cities or so across the country, eventually international perhaps as well. And we have about 45 different metrics per city that go into an algorithm that really help us select and kind of shortlist the cities we want to go into. And that ranges from how do we build the networks? Are there health systems in the city we want to work with more closely? Can we technologically integrate with those systems in a deeper way? Will they want to go at risk with us over time? Can we share healthcare medical risk with them? So therefore, will we be aligned properly with them? What does the competitive situation look like? Are other insurers in the market? Which networks do they try to build around hospitals and physician practices? And this all gets sort of like put together, and then out comes the cities we go and talk to. And right at this moment, we're already on the road, literally basically demoing the product to hospital CEOs in other parts of the country. That's usually the best way to build networks for us. We meet with the hospital physician leaders, and we simply show them how Oscar looks, how easily the physicians we work with can pull up information about the members we have, how easily we could integrate on the EHR side, for example, how we do all these things differently than other insurance companies would do them.
So just to sort of drive that point home, you're already right now preparing for 2020 and beyond.
Yep.
So you have a sort of a longer cycle time than maybe some other kinds of startups.
Way longer, exactly.
And so when you kind of look out then to 2020, 2021, what does the trajectory look like? I mean, should we expect you to add 6 more cities over the next few years?
That's definitely one of the pathways we have. You can expect us to add as many cities next year, if not more, as we did this year. We feel like we're at a point where we've built a very interesting blueprint to go into a new market. When we go into a new market, we get membership right away. We had 40,000 members come to us in Austin. We launched there. We launched a plan with the Cleveland Clinic, built around the Cleveland Clinic actually, in 5 counties in Ohio for 2018. where we share risk with Cleveland 50-50. It was the first time that they, as a provider system, basically became a quasi-insurance company together with us. We manage the plan, the member experience, they essentially deliver the care, and we connect more deeply on the data side. So these things are only possible because we have now built all the underlying systems to be able to do those things. We started in 2012 essentially thinking that you can potentially build an insurance company in the way, I used to build a software project. You find the best APIs out there, you put things in the clouds, choose between Google Cloud and AWS, whatever, build it that way. And the reality is healthcare really doesn't work this way. None of the vendors in the market really is able to deliver real-time connectivity on the data sides. We have vendors that for years have said we will have an API eventually, and I'm not sure they mean something different than we mean, but that must be the case. So we had to essentially build everything in-house, and it took us the first 5-6 years of our existence to build that infrastructure, everything from claims to clinical management to the concierge teams we have. This all flows together in our systems in, I think, unique ways, and that now enables us to go out and build expansion markets at the clip we're doing it now. So one pathway is more cities. The other pathway is more product lines. You will see us over time go into other parts of the insurance markets. The overall vision has always been the healthcare system in the US is so costly, partly because it's complicated, and it's complicated because no end user really ever can put any real competitive pressure on the value chain. You don't really choose your insurance company. Oftentimes, your insurer will build a broad network where the systems in the network won't really compete, and as a result, you get this sort of like very loosely, not very competitive value chain in healthcare. Over time, I'm pretty convinced more and more of the healthcare and health insurance markets will blend, first of all. Healthcare and health insurance will look more and more alike in a sense. And those markets will individualize as well. There will be more and more individual choice in that your employer might give you the money to go and pick a plan, and then you will go and pick that plan yourself in the markets. And so therefore, if we can take the infrastructure we have and apply it to all the various market segments that are out there, that's the other pathway we have.
Got it. And I do want to ask you about something else that was in the news, which is Oscar's coverage for transgender individuals. There was a coalition that sent you a letter, I think yesterday, essentially asking you to cover transition-related medical care in all of your state plans. And I'm wondering if you have responded to them yet and how you plan to do so. Yeah,
we got the letter yesterday, and we take that very seriously. So let me say, first of all, I have a deep conviction we should be covering these services, and that insurers should all be covering them in all states. We cover these services in California and New York, so we try to cover it where we can. The places where we agonized about this quite dramatically, really, in our case, were in states where the states don't mandate the insurance companies that they cover these services. And there is a risk that we become the only insurer in covering it. And as much as we want to be the first insurer in pushing the envelope and in covering services that we believe will be better for the healthcare system and for society, if we sometimes are the only insurer, we're not at the point where we can sometimes shoulder that financially. And so that's what we're trying to navigate there. But we got the letter. It is extremely helpful feedback, and we're on it and will look very closely at what we can do there to make sure we push forward in the right way.
Do you think you might expand the coverage?
So what we certainly are doing and have been doing for the past year as well is push all the regulatory bodies where these services are not mandated in the states where they're not mandated to make sure that they mandate them so that the playing field is a level one and that we can push forward there. And that's the conversation we're driving at the moment.
What do you plan to tell these groups?
We'll see where we respond now, but I'll keep you closely posted there.
Okay, and you mentioned selling other kinds of health insurance. Have you talked to Amazon, Berkshire, JP Morgan? Some exciting news there about synergies.
Whoever asks, and I'm very happy to give a demo to, and so we have given plenty of demos and shown plenty of people connected there, I think, how what we do works. Again, I'm very glad that people are pushing on the healthcare system in different kinds of ways, and I think they could make a big difference. I think some of the recipes that you need in healthcare are fairly clear by now, and I do think 5 years ago, when we said we want to build a member-centric insurance company with better member experience, where we can become the entry point to healthcare, that was kind of a new thing. Not many insurers were talking about this. The fact that now others have adopted these talking points and are pushing in the same direction, I think is a great thing. What I actually told some people there is that in my view, the biggest impact they could have right away is to push, again, the federal regulators to let the employers simply take the money that they give the employees now and give it to them pre-tax and let the employees then choose which plan they want to buy. To me, that would unleash most immediately the biggest competition in the markets. Amazon is a big believer, I believe, in building platforms, right? I mean, the store itself is a sort of a platform, AWS is a platform. This would essentially make them the platform for employees to buy healthcare services and health insurance coverage in a different kind of way. That could be the most short-term thing they could do. And then, we, among others, could compete in that. And that would be a pretty fantastic thing, I think, for the overall market.
So you could go on the Amazon health insurance store and buy insurance from Oscar or Blue Cross Blue Shield or United.
Yeah. And their own employees could do that with pre-tax dollars. There's a professor at Harvard Business School, Professor Hertzlinger. She calculated if you did that across the United States, then many people would opt into different deductibles, different network designs, and so on. It would free up 150 billion or so per year in additional income, because you could take some of these sort of like overfunding sometimes of premiums and basically just earn it as income. And even the Treasury would earn more in income tax, because that would impact tax as well. And so that would be essentially good for everybody, except for some of the incumbents in the healthcare system, some of whom are too fat and too happy.
Well, let me ask you, you've spent some time thinking about how to disrupt healthcare and health insurance. Do you have any advice for Atul Gawande as he kind of starts on this quest?
That honors me that you asked me that question. I do think purely from our perspective now, the full stack notion we had, I think, is extremely important. This is not an industry where you can just rely on being the data glue, the technology glue, the user interface glue around other people's services. You got to go full stack and rebuild the entire infrastructure. And I think he ought to do the same thing there. I'm sure he's getting tons of inbound from all kinds of people who want to give him one piece of the puzzle there. I think he ought to ideally go and build this himself. Short of that, find ways to simply enable more competition in what others are building more quickly in the way, for example, I proposed. I do also think that health insurance and healthcare is an area where you can't apply the sort of like Uber model or whatever, where you kind of go all the way to the breaking point of the rules, and then you see how that works with the regulatory bodies. The regulators in this industry are very common sense driven. I think they're very public policy driven. Different opinions and kind of different views of the world in different states. But you can work with them and push them and try to do things differently together with them in a way I think that can be powerful as well.
And in terms of lessons learned, you actually have a small health clinic in Brooklyn. Mm-hmm. Do you have any other clinics in other states, or is that pretty much
That's the one we have. Yeah.
What have you learned from actually trying to operate a clinic and having doctors and sort of being on that side of the table as well?
Yeah, that's so one thing we always think through is the blend between health insurance and healthcare coverage. We, in essence, to some degree, also are, enabling care delivery as an insurance company. We actually have a whole bunch of in-house physicians that deliver our telemedicine care. We have what we call concierge teams. These are between 4- and 6-person teams that cover a panel of members, and all of our members are assigned to one concierge team. One of the 6 generally people on the concierge team is a nurse and essentially can help you through clinical conversations and connect you also with the telemedicine doctors we have. And so we deliver a fair amount of virtual care, if you will, through the Oscar services. This is one place in Brooklyn where we actually do it in person as well, in a physical way, if you will. And the biggest thing we learn there is where are the ideal handoff points between us as an insurance company, the concierge teams, our virtual physicians, and then really the people in that clinic. One great learning from the clinic, for example, is that we have mental health care professionals in the clinic as well. They have a very, very nice way of really taking at first, sort of like face value clinical case, a member who has a certain physical ailment or something like that, and translating this very carefully into also saying, is there a mental health issue related to this as well? And that is actually more easily possible in person by blending these two kinds of services. That's one big thing we've learned. Now try to take back in to the way we deliver telemedicine, in the way the concierge teams operate, and so on. The key principle behind all of this has always been we would like to be the entry points to the healthcare system for members. So when you buy Oscar, you get the welcome kits, download the app right away and things like that. We try to really teach you almost as a member that whatever issue you have, come to us first. Chat with us first, talk to us first. And one interesting data point is that we, in any given 7-day periods, when we add up all the various channels through which you can interact with Oscar, telemedicine, searching in the mobile app on the web, talking to your concierge team, chatting with your concierge team, all these things, we add all these up. We, in any given 7-day periods, end up interacting with about 26% of our members. So about a quarter of the members we have really are actively engaged with us in any given week. If we look at those members who end up going to the emergency room at the end of that given 7-day period, so there's something happening in their lives, that number goes up to 80%. So in other words, if you can really have a good viewpoint into how people are starting to get worried about something, they're searching something in the app, they're asking their concierge team, but something sometimes as innocuous as, what's my deductible at right now? You can anticipate much more in a better way what members will end up potentially needing out of the healthcare system, and we can then be there and deliver that care and provision the care ourselves. And one of those ways to do that is the clinic.
And I guess one thing I wanted to ask you about is we've talked about using the app and how that can start to let you guys kind of redirect care. Mm-hmm. When do you think that will start to affect the bottom line and sort of improve the financial results?
So I think the answer is it already has affected the bottom line. And here are the numbers. When we look at all first-time physician visits of Oscar members, about 43% now in the latest counts of those we can trace back and see that the member, before he or she went to a particular doctor, found that doctor through the app, by talking to the concierge team, being on the website, one of those channels basically. That's about 10 times higher than is the case for any other insurance company as far as we were able to find out. And in those cases, members look for a particular physician or a condition or a symptom or whatever else. We propose physicians to them and they end up going to those we propose. They can go anywhere they want, but it's more convenient oftentimes because we have direct appointment scheduling in the app. We have integrations on the EHR side with the physician to go to those physicians. And then when we look at those physicians, they on average drive about 9.8% lower total cost of care. So when we take entire episodes of care managed by the physicians that members go to, and we look at what's the total cost of care there, including lab utilization, imaging utilization, and so on, compare that to the rest of our network, not every physician, but the rest of our network, our own claims costs basically, those are 9.8% below where you would have been as a member had you gone somewhere else, and you 11% higher member satisfaction actually. So the members end up rating those physicians. We send emails, the app asks you about physician ratings, reviews, then as compared to the rest of the network there as well, which again goes to something that I think Atul Gawande also wrote about a couple of years ago in the Medicare article he wrote there, which is that cost in healthcare almost never correlates with quality. However you define quality, whether it's clinical outcomes or in this case member satisfaction, those two are uncorrelated. And so when we plot our physicians, we got one real-time dashboard that plots our physicians based on how efficiently they deliver care versus how happy the members or how good the outcomes are. There's never a correlation, so we can focus on the ones who make members happy, drive good outcomes, and lower total cost of care, and integrate more deeply with those, and get more of those physicians over time.
Got it. And just coming back to that, I think there's been a theme at this conference around trying to figure out whether things are sort of overhyped or underhyped, overrated or underrated. I want to ask you if you think that this Amazon, Berkshire, JP Morgan venture will turn out to be sort of overhyped or underhyped, or are we just right?
I think it's very hard to overhype the fact that they did this. I think it's a pretty bold thing to do. We had 3 big CEOs getting together. That's